Hi there, my name is Dr. Ross Pelton. I'm a pharmacist, certified clinical nutritionist, author of 10 books, and I'm currently the scientific director with Essential Formulas. Happy to be here with you and discuss some topic related to probiotics and the microbiome today.
Thank you, Ross. The question we want to ask you today is, what do you call an upset microbiome, and how do people get an upset microbiome?
Okay, good question, something everybody should know a little bit. In the industry, the term that is used for an upset microbiome is dysbiosis. Now, a healthy microbiome contains roughly about 85 to 90% good bacteria and only 10 to 15% bad bacteria. We all have some bad bacteria, but in smaller numbers, they really don't cause us problems. The problems arise when, for one reason or another, that balance gets upset and people end up with too many bad bacteria. And then we call it dysbiosis, and that simply means that people have symptoms of an upset microbiome: gas, bloating, diarrhea, constipation. All of these things are symptoms of an upset microbiome. And although the industry refers to it as dysbiosis, I've coined a term and started to refer to this condition as a pathobiome, a pathological microbiome. Now, there's a number of reasons why people develop an upset microbiome. Probably the most important and most prevalent reason is consumption of antibiotics. When you take an antibiotic, you don't just kill your bad bacteria, you also kill a majority of your good bacteria. And when that happens, if people don't consume probiotics following a course of antibiotics, the bad bacteria can compete on an equal footing with the good bacteria to repopulate your intestinal tract. And instead of a 90%, 10% ratio or thereabouts, you'll end up with 40-60 or 50-50, far too many bad bacteria. And that's when you start to have all these symptoms develop. Now, in addition to antibiotics, there's another number of reasons why people can develop a dysbiotic gastrointestinal tract. Acid-suppressing drugs, the proton pump inhibitors, the H2 blockers, and just regular over-the-counter antacids, anything that suppresses acid secretion is going to contribute to a pathobiome. And the reason is that a healthy microbiome needs to have a slightly acidic acid-base balance. And if you suppress acid secretions by taking these acid-suppressing drugs or antacids, you'll end up with a pH or an acid-base balance in your gastrointestinal tract that's too alkaline. And that's the pH that is supportive and encouraging the growth of bad bacteria and suppresses the growth of your good bacteria. And another problem are steroid drugs. Birth control pills and hormone replacement therapy also tend to upset the microbiome. Chemotherapy is horrible on the microbiome. So these are all classes of drugs that will upset the microbiome and contribute to what I call the pathobiome. And then on the other hand, we have the diet. One of the most critical things for creating and maintaining a healthy microbiome is how you feed your bacteria. It's not just enough to take probiotics. You have to learn how to feed them well. And if people eat junk food diets, processed food, high sugar, high fat, low carbohydrate diets, you're feeding the bad bacteria. And unfortunately, that's the diet of a majority of Americans. It's called the Standard American Diet, and I abbreviated SAD for Standard American Diet, and it's a pretty sad diet. Then on top of just the dietary considerations, there's the pesticides and insecticides that are ubiquitous in the agricultural food supply. They're also used liberally residentially in lawns and gardens, and these have a very toxic effect on your microbiome. Wide range of other toxins in the environment like mercury and lead and cadmium and arsenic, and all these different toxins in the environment have an effect on your microbiome. Just things as simple, people don't think about chlorinated water. The cities put chlorine in the water supply to kill bacteria. Well, when you drink that, you're going to kill some of your bacteria in your microbiome. So I always encourage people to think about feeding your microbiome and trying to avoid the conditions or situations that are going to suppress your microbiome or contribute to the growth of pathological bacteria. So that's a little survey of some of the reasons why people get a pathobiome or dysbiosis. And I really encourage people, although I'm in the probiotic industry and I promote and talk about quality probiotics all the time, one of the things I really try to emphasize to people is how important it is to feed your probiotics well. You can take seeds and throw them out in a desert, and if you don't water them and they're not on fertile soil and getting the nutrients and the sunlight and so forth that they need, they're not going to grow. And the same thing happens in your microbiome. You can take probiotics, but if you're not feeding them well, you're not going to have much success. So take good probiotics and feed them well and maintain your healthy microbiome. That's my message for the day. Remember, every time you eat, you're feeding 100 trillion guests. Thanks for listening.
Great. Thank you so much, Ross.
You're welcome.